Hello, my name is Tanya Vogt, and I'm the Executive Officer for the South African Medical Technology Industry Association, or SAMED for short. I would like to explain how SAMED was able to support the COVID-19 response in South Africa and is planning to contribute to pandemic preparedness. During COVID-19, SAMED acted as the voice of the South African medtech industry, and we facilitated numerous engagements. We communicated daily with members during the first wave of the pandemic and provided the latest news on legislation and policy and the state of the pandemic. Representing the medtech sector, SAMED acted as a conduit for information, facilitating consultations and partnership requests, and served as a repository and disseminator of knowledge. We were able to arrange information sessions with a range of government agencies to overcome bottlenecks and assist companies, ranging from the National Treasury to the Ports Authority. In addition, we circulated calls from our Department of Trade, Industry and Competition to upscale supply of much-needed medtech. We held numerous information sessions with the South African Health Products Regulatory Authority to help the medtech sector understand the significance of regulatory measures with respect to ensuring safe, quality, and effective products enter the market. This was specifically important during the pandemic since the sense of urgency had negative consequences on the integrity of the supply of essential medtech and hindered efforts to increase local production. SAMED has also used the COVID-19 generated interest in medical devices and life-saving technologies to educate the public on ways of evaluating the quality and performance of various medtech products. This educational role extended to those making medtech procurement decisions within the health system. We recognize the critically important role that regulation of the medtech industry plays. And so the association will continue to strengthen the Medical Device Code of ethical marketing and business practice and advocate for its wider applicability. SAMED will also keep on actively supporting anti-corruption initiatives by government, the private sector, and civil society, advance value-based procurement and supply of quality medical technologies, and we will recognize and support the role of the government regulator in building a trustworthy, regulated, and compliant medtech industry. SAMED aims to sustain and deepen the relationships forged in the heat of the COVID-19 response, and we've identified a number of key actions to build back better and be pandemic prepared. These include delivering and developing a comprehensive medtech strategy as part of a multi-sectoral pandemic response, aligning structures by recognizing the complementary roles of international and domestic supply chains so that access to a full range of medtech is always guaranteed, enabling stakeholders through reviewing and reforming regulatory processes and overhauling related administrative systems to attain the agility required in times of crisis, building understanding by capturing and enhancing data quality on the medtech sector, fostering relations by validating the role of private sector membership organizations in the health system, and most importantly, nurturing trust through commitment to an ethical medtech industry and value-based procurement and supply of quality medtech.